think back to my first patients, my first year of PT, as a PT, and think back to, wow, I could have helped them probably a lot sooner and a lot more efficiently, knowing what I know now.
Well, we've all been there before. We've all been clinicians. We've all gone through that struggle.
The thing that was always frustrating for me as a student and obviously as an educator, it was such a static process, how you're looking at particular pictures and they don't really tell the entire story.
I know when I was going through PT school, the textbooks were very much, right, chapter 2 is objective testing for everything. Chapter 3 was now treatment for everything. So flipping back and forth, the process was really hard to kind of learn on your own.
Normally students come in without any background. They may be familiar with the diagnosis, but they come in, we show them test after test, and then we expect them to retain everything that they've done in class, and then they go home, and if they forgot, one little tiny portion of it, then there's no way to recapture that.
The students themselves really desired to have this dynamic component. And it wasn't unusual at all for me to be in front of a group of 30 to 40 to 50 students, and half of them had their cell phones out or their iPads out, filming what it was that I was teaching.
We started clinical pattern recognition because we had a vision for helping young clinicians become experts faster.
We knew there had to be a way that would be easier to help students and early clinicians help their patients.
We use our phones for everything every day. We use our computers every day. You now go into school and see everyone with a computer.
There's more out there that we can do to bring education alive. And one thing that one of our professors did when we were in school was videotaped the skills that we did. And that was almost like the starting point of ideas coming, oh, we can actually watch this again.
We could see what was happening in entry-level education and begin to understand how that affected them in the post-professional life when we observed them and watched them and taught them in residency and fellowship. And so we believe that using new technology, using videos, using clinical practice guidelines, that all of this would allow for us to fast-track the young clinician in how they thought and how they saw patients, and how we integrated the guidelines into this very useful tool that you can have in the palm of your hand.
The digital application, it's an easy back button or forward button, and there's these algorithms built into this app where you can just follow it through and not have to try to take and piece things together on your own, but that's what it's there for, is it pieced it for you, and you can learn better that way.
We've decided it's time to make a transition to Physio U because our vision for the tools that we're building for learning and for clinical use has expanded beyond just the clinical pattern recognition orthopedic series.
No longer we focus just on orthopedic physical therapy, but all parts of physical therapy, as well as even past physical therapy to other types of medical professionals. We have a gait and transfer app coming out that for anyone in acute care, whether it be nursing, we have a running app that's going to come out, and a sports movement app for athletic trainers. They're helping their patients. We have a wrist and hand we can use for occupational therapists. And then also the word physio kind of resonates more with international. And that's kind of where we want to make sure we're globally impacting the world and making clinicians better to help all types of people anywhere, regardless of where they live.
We had already translated this app into Mandarin, being the very first one, and have every intention to put this in multiple languages. Our vision is that this would be a vehicle for multiple educational systems throughout the world.
Our hope is that Physio U will eventually become a community and where we can come together internationally, have questions, have cases, have ideas of how we should treat things. Be a place where thoughts, great minds, inquisitive minds, young minds can all gather and can glean from one another.
I think we all go with this want to be better, this want to serve, this want to grow and excel and be great at what we do. We are never perfect. There's always room to grow, and we understand that. So this is our opportunity to continue challenging us to excel to that next level.